Alrighty, I think we are live. Hi everyone. We're gonna wait for a couple of our friends to gather. I'm Dr. Funke Afolabi Brown, and we are in for a treat today. We are having an amazing conversation for busy moms, professional women, and we are going to be talking about insomnia in women. And so I have Dr. Shelby Harris that should be joining us soon. Dr. Harris, if you just request to join, we'll have you hop on and we'll get started. I hope everyone's had a good week so far. Hi there. Hi, Tracy. Looking forward to engaging with all of you. You should be seeing Dr. Harris soon, any moment now. Yes, there we go. You made it
Hello.
here. How are you?
I'm good. How are you?
Good, good, good. Listen, I love how I texted you and we're like, should I call you Shelby or Dr. R? You're like, I don't care. Should I call you Fuga? I'm like, I don't care. Whatever.
Uh,
I'm like, that is my person. I love it.
there you go. I love
I know. Good to see you. Hey, look, we have people joining, and
it.
I was just starting to say we're going to be talking about all things insomnia in women.
Mm-hmm.
For those who don't know me, my name is Funke Afolabi Brown. I'm the founder of Restful Sleep MD, pediatric pulmonologist, sleep medicine physician, passionate about helping women and their kids sleep better. And so, do you want to introduce yourself and we'll jump right in?
So I'm Dr. Shelby Harris. I'm a clinical psychologist by training, but I'm board certified in behavioral sleep medicine. So I work with babies through older adults on sleeping better without using medication. And I ran the Behavioral Sleep Medicine Center at Montefiore Medical Center for over a decade before going into private practice now. So yeah, I'm
Love it.
about sleep for all in the
I know. I know. I love it. I love it. I love what you do. And
same here.
I'm obsessed with sleep. One of the things this is like, I wasn't planning to bring this up
Yeah.
too much. I was going to mention your book, which, oh my goodness, by the way, I'm like, oh, let me just, read a few pages so I couldn't put it down. I
Oh, you're
couldn't
so
put it down. I'm like, we should have talked about oh my gosh, it's such good content.
Thank you. It was funny. It's like I wrote the book. I signed the book deal when I was 9 months pregnant
Oh
because
my word.
I was like, oh, I'll have
What
time.
else? What else is there to do?
It's second child. You think I would have known. But it was funny because like people were a little bit talking about women's sleep issues, but it really, I mean, this was like 2017, 18 when I was writing it. It wasn't such a thing. And over the past year or two, with like that whole space of perimenopause and parent sleep has just like exploded in a wonderful way. So I'm glad that people are kind of thinking about it much more.
Yeah. I love it. And for those who don't know, it's the title of the book is The Women's Guide to
Over,
Overcoming Insomnia.
you got it.
Oh,
Got to get a
that's it.
nice sleep without relying on medication. So
Yes,
I want people
yes.
talking about their sleep.
It's perfect. It's perfect. So I think that's an excellent place to definitely start. But then let's jump right in. Let's reel it in because we could just keep talking.
I could,
All right. Focus, focus, focus. Okay. So insomnia, let's even start with that in women and
yeah.
sleep issues in women. Like, what's that all about?
So I think there's a few things. I mean, women have a higher rate of insomnia in compared to men in general. And I think there's a few reasons. So one is there's a biological component to it for sure. So we find that around a woman's period every month, some women tend to, a few days before they get their period, they tend to have more insomnia. Other people actually get excessively sleepy, but there can be that hormonal component to it. Then we talk about pregnancy, right? Postpartum, there's insomnia issues all over the board. And then perimenopause, which is the space people are talking about so much more, is another issue where we see sleep issues. But then you take that, we have more risk of psychological anxiety, depression, and then there's stress. So a lot of times women are dealing with their family, but we also have so many roles, family, work, taking care of our parents a lot of times who are aging, that there's just no time to decompress the brain and then go to bed also.
I know, and it's such a huge thing. And one thing I wanted us to kind of sort of debunk to even start with is the fact that, you know, as women, as professional women, whatever stage of life we're in, we will all have, like, and men too, of course, and kids too, everyone, we'll all have like sleep issues
Yeah.
during periods in our lives. And so that doesn't may not necessarily mean you have insomnia, but it's really important to understand the difference. Like, you'll have a bad night, a couple of bad nights from time to time,
Yeah.
but you don't have to label yourself with that. You may end up eventually having insomnia, but it's really helpful to understand where that is coming from.
I
Um,
say to people a lot, I'm like, I can't
yeah,
even diagnose you with short-term insomnia unless it's been going on for at least 3 nights a week for a month.
yeah.
And chronic insomnia is 3 months. And most people don't think, but they think about 1 or 2 bad nights here and there.
Mm,
I
mm,
must take all these things to fix it. Like,
yeah.
human being, I don't sleep perfect every night.
I know. See, you hear it.
I,
If we also have a sleep issues, it's
yeah.
definitely gonna come. It's definitely gonna come. And you know, the other piece I wanted to talk about, again, something that I'm passionate, because you know, the way this all started for me was really seeing my patients, right? Kids coming in with sleep issues, and the parents literally cross-eyed from sleep deprivation, and realizing that with childbirth, that does a whole
Uh-huh.
360 to your body, first of all, and then mentally you're watching that baby take every breath in, and all of a sudden the baby is now sleeping well, but you can't figure it out. And so now it becomes this spiral.
Yeah.
So I wanted us to kind of dig a little deeper into some of those issues. How do these things then become triggers for insomnia in women? This either life changes or things like that, then now get into this spiral and they're just stuck in.
Yeah. I mean, there's a few things. So the first one is when we talk about, like, people, this is a really common one, is that when people have a baby and then the baby starts sleeping well, and usually it's the mom, the woman, I just can't sleep anymore. I still can't sleep even though they're sleeping well. It's a conditioned response that's happening. People, I think a lot of more chronic insomnia, there are things that kick it off. Having a baby, a new job, financial stressors, there's medical stressors. There's a lot of things that kick it off, but it becomes conditioned. So especially when you have a baby that's now sleeping well, you're always listening for the next threat, essentially, to your sleep. Well, what if they wake up? I'm so used to them waking up. People will keep their monitors up pretty loud still to listen for the baby. Kids make noise when they sleep. That's going to, so it's, you can never really turn off because you're just waiting for the next shoe to drop to get in the way. And so people start doing things, right? They'll start going on their phones more. They start to nap when they can during the day to catch up for it. And it's all those behavioral things that get conditioned to really keep the insomnia going longer term.
Yep, that is so true. It's almost like your flight or fright response is just now kind of reprogrammed perpetually.
Yeah.
And so it's such a huge piece to it. So now I know when we kind of were talking about what are we going to talk about, and you know, I am a huge proponent of sleep hygiene. By the way, I don't necessarily call it sleep hygiene because I just feel like hygiene. Why
It's,
hygiene? Come on.
yeah.
But right, healthy sleep habits are a good place to start.
Sure.
But first, why do we then say, in what situation would we then consider, okay, you've done all the, you know, sleep hygiene, you're trying the best you can to maintain consistency and stuff like that. Maybe we'll go back and even go over some of that to
Yeah.
start with. And then when would you say, okay, there seems to be a little bit more going on at this point. Let's really take this to the next level in
Yeah.
terms of getting the help you need.
So I like how you call these sleep habits. I always call it sleep hygiene just because a
Yeah,
giant in the field, Rachel
it
Mann,
is.
I will never forget her talking about it as like dental hygiene. And I talk about it all the time and I credit her. Because she said, think of sleep hygiene like dental hygiene. If you brush and you floss every day, you're going to help to prevent a cavity from happening, or it won't be as bad. It's the same thing with healthy sleep habits. If you do them routinely, it might help to prevent a really bad insomnia from happening. So I always think of it as kind of the baseline that you want to do. So what are some of the things? Limit alcohol 3 hours before bed. Limit caffeine about 8-ish hours before bed. Stay away from screens an hour before bed, or 2 hours if we can. Limit the naps, consistency, all that stuff is the sleep hygiene that we're talking about. But a lot of what we see is when it comes to chronic insomnia, people 9 times out of 10 come to me like, I've done all that stuff and I'm still not sleeping well. Well, that's because sleep hygiene is great for someone who has the occasional night here and there, or just wants to kind of make sure that they get more sleep. But if you have insomnia, you're trying sleep hygiene and it's not working after 3-4 weeks, you need to see someone for more intensive care for sure, because there are other treatments. CBT for insomnia, for example, we use sleep hygiene, but that's just kind of the basis initially. Then we build all this other stuff on top of it.
Yep, yep. I love that. I love that. And something else that I hear is I've tried
Yeah.
everything. You know, by the time they're coming in, it's like I've done it all, really. And just really realizing that as women who are struggling with insomnia, there are other options out there that definitely should be explored. So then that would be a segue to what are those options? What usually what are the strategies that you tend to recommend
So it
to
really,
start?
but a lot of the women that I see that are struggling, I mean, there's so many different areas, right, of when
Yeah.
women can have sleep problems. There was just this great study that I think I'm going to post about next week about digital CBT for insomnia in pregnancy, right? So even doing CBT for insomnia without using meds was very useful for some women during pregnancy. And a lot of people will go to their doctor and they'll be like, don't worry about it. It's normal not to sleep when you're pregnant or you just had a baby. Yes, there's some normal sleep loss, but to have extreme lack of sleep is not normal. So at any range, I'll talk about basic sleep hygiene, but then I love to try CBT for insomnia for people because it is non-medication approach. But first, it's not for everyone. And it doesn't work for everyone. It works for a lot of people, but not everyone. So then it becomes a discussion of, are there other sleep issues going on? So is there sleep apnea? Is there restless leg, periodic limb movement issues? That's a discussion that maybe we need to do a sleep study, have a consult with an MD. Then we talk about medications, right? I see just take a Benadryl. Then it's medications, right? There are medications that are, that people do use at various times for when they're pregnant, postpartum, when they're going through perimenopause. And then I try to target as well if we need to talk about hormones. And I'm not a specialist in that at all, but sometimes people have these misconceptions of what HRT is and that it shouldn't be for everyone. And I try to send them to someone who's very knowledgeable about it to have that discussion. I think of everything when it comes to insomnia as a tiered approach, least invasive to then kind of going down to using medication if we need to. And then the other big thing with women is I see all the time is the hot flashes. I'm waking up hot at night. We can do medication things. Sometimes CBT helps with it. And then I also think about how we can optimize the room, right? So there's the new chilly sleep pad that people love, and there's the sweat wicking pajamas. We have to think about it in so many different areas. Yeah.
Yeah. I love that. And I need to check out that too because I'm hearing it a lot more now. I need to definitely I need to check it out.
Let us know.
I know. I'll keep you posted. I'll keep you posted.
People really,
Yeah, yeah. It's so funny you say that. Like, I love that. It may not necessarily, there may be things that we are overlooking, like
yeah.
literally the low-hanging fruit that we can actually address. And at the end of the day, even if you do end up needing like the full CBTI, but at least you've made sure that you've kind of dealt with those issues. And, and
I always say to people, good luck
yeah.
having anything else work if you're drinking like 4 cans of regular Coke at night before you go. You need to make sure that basic ground is working.
Exactly. So again, one of the things I want folks to take away is while we're definitely saying you may need more than sleep hygiene, you still need to go back to those basics constantly. And when you've tried everything, make sure that by the time you're coming and saying I need help, you're not already kind of receding to those old habits, right? And also one of the things you said that I love, one of the way I just try to categorize it too is I kind of say, okay, let's look at sleep in 3 different categories. And it was actually one of my mentors, Jody Mindell, who taught me this, and it's just stuck with me. And it's like you have to look at sleep in terms of the the medical problems, which is huge because if you have restless leg syndrome, I mean, it's extremely uncomfortable, extremely disruptive, and it's something that's treatable. So really looking at those medical issues that can be affecting your sleep. And then the behavioral issues, right? Like, habits and things like that.
Mhm.
And, sort of what else could be going on? What else are we doing that's now caught us in a spiral?
Right.
And for me, a lot of kids that have psychophysiologic insomnia, where their mind is just like on nonstop. And then the third is sort of what are those issues that are present during the day that impact your sleep at night? So for a kid who has autism or ADHD, it doesn't go away when they're going to sleep. For a woman who has anxiety, right, or depression, like there is a bidirectional relationship. So it's like we'll work on your sleep, but you may need therapy, you may need antidepressants, you may need anti-anxiety medicine. So really looking at it across the spectrum to really then give you this holistic view. And granted, it's not something that, I mean, your primary care doctor, your pediatrician, they're doing the best they can with the limited time. And this is where then you may need that extra level of either a sleep expert or someone else to kind of help kind of tease through all those barriers, because there are a lot.
Yeah. And I always stress it, especially women, just because, I mean, I treat all different ages and everything, but especially women who kind of get brushed off sometimes, right? Mm-hmm. You're fine. It's normal to be tired. It's not, and that happens.
I don't sleep myself. Have you heard?
I've heard that a lot. Sleep is over.
I don't sleep either.
It's the more, if you feel, I always say this, that you're the expert on you. And if you feel that something is off and someone is not, and you're seeing your doctor and you're just not getting answers, or someone was told to just drink warm glass of milk, right? Like that's not evidence-based treatment. So if you really feel like you're just kind of getting brushed off, find a doctor who'll listen to you. And that's really going to be the key. Like you were saying, we have to think about people and really like a whole model. And if you're just getting these little bits of do this or just ignore it, it's not the right treatment for you.
Yep. I love it. Tell us about this tired but wired phenomenon. I know it's all part of it.
I mean, I think of it as like the tired but wired is that a lot of times people, especially with insomnia, they're so tired, but then when they go to bed at night, I have no energy. I always say fatigue is like you're just dragging a ton of bricks behind you all the time. You just have no energy. But the wired aspect is that our brains are just going, right? So you can't, even though you're exhausted, you can't go to sleep. So you're not actually feeling sleepy. Sleepy is that feeling of irrepressible need for sleep where you just can't keep your eyes open. But a lot of people with insomnia feel tired, but that kind of, my brain's going, but I want to go to sleep, but I can't because my brain's going. And that's the experience that I think most people have with insomnia.
I bring that up because that is something I hear all the time.
Mm-hmm.
All the time. So I would love for us to just kind of come up, what would you say would be like your top three, for example, if we've kind of figured out it's not sleep apnea, maybe it's not restless, but I'm just like tired but wired. What would you say for that busy woman, right? All the obligations of the world, all life changes, and exhausted all the time, but hits the bed.
Yeah. There's a few key things that I always start with. So one, if they routinely have trouble falling asleep, it goes completely against what most people think to do. But I say, you know what? You're going to bed too early. So for some people, I actually have them go to bed later so that they're actually sufficiently sleepy. So people say, well, I should go to bed now because it's 11 o'clock and everyone around me is asleep. And it's just the normal time of what I always did. Well, what if we had you stay up an extra hour? I know it's a little bit of sleep deprivation at the beginning, but it might help to actually get you to fall asleep faster. So that's one thing I try with some people. And I advise people to think about getting in bed when you're sufficiently sleepy. But if you are just, I don't know, binge watching things on your screens, you're doing, good luck getting sleepy because you're always in front of a screen, or you're doing work, or you're doing all the chores in the house, and you're just going. You need to protect time for sleep. So a lot of people, it's very hard to do that. So I start with just 5 minutes. Find some relaxing activity without a screen in your face and just protect 5 minutes to do something that's quiet, calm, and relaxing in dim light. And then once you get better at 5 minutes, move it to 10 minutes. And doing that a little bit more helps to kind of create that dimmer switch so your brain goes from awake to sleep slowly. And then the one other thing that I'm a huge proponent of is meditation. People think that, meditation is the thing where you should be right now for sleep. You should be listening to the apps and then just kind of using it as a sedative. I encourage people to listen to meditate for a minute, 2 minutes during the day, because the more you practice meditation during the day, you get stronger at being able to redirect your busy brain. So if you do it during the day, it makes it easier to recognize when your brain's going boop, boop, boop at night, so you can let it kind of quiet down and focus on some deep breathing to help induce sleepiness.
Love it. I love that element of finding that time. It doesn't have to be 15, 20 minutes. Just practice being still.
It's not,
Practice it.
it
Yes.
can't be like an hour or I don't do it at all. What
Yeah.
can you commit to and then
Yeah.
slowly build on it?
Yeah. Yeah. And something that I also suggest in terms of just being intentional about that is just setting a reminder, meditate or pause or reflect, whatever. And we all have our Apple Watches. Let it buzz and,
I know.
and remind you.
Like apps, there's an app called is it Mindfulness Bell that has like a gong that goes off at random
Oh my gosh.
sessions with patients when their
Yeah.
meditation bell will go off and like, nope, 2 minutes, we're going to meditate.
That's
So
perfect.
you just be in that moment.
Yeah, yeah, yeah. I love it. Listen, this has been incredible. We said we were going to keep it short and sweet,
It's been
but
great.
I know. There's a question. Are split nights for women?
Oh, I guess she's asking more about the biphasic sleep pattern, maybe.
Mm.
I mean, it's such a hot topic now. I get interviewed about it a lot. I think of it as like is it under the umbrella of insomnia? Insomnia is when you're having trouble sleep and it's causing a problem for you. So if you have a biphasic sleep problem, hi, sleep talk nerd and Val. So if you have the split pattern and you're bothered by it and you don't like being up for 2, 3, 4 hours at night, guess what? You probably have insomnia. But if it works in your life and you don't find it has any issues during the day or causes any issues, I personally am not going to start treating it if it works in your life. What about you? What do you think about it?
So the way and it's so funny you mentioned this. I've had people ask me as well, like, I have this, and way pre-industrial times, apparently this was it and all that. But you have to think about the society you live in as well. I mean, if we could have moments where we could pause and just sleep through the day and still get our work done, I mean, it's not technically insomnia, because with the definition of insomnia, it's causing some kind of impairment in
Yeah.
you or a member of your family or your function and things like that. So
Yeah.
if you have a system in place where you can take a break from sleep, and then continue, and you're sure that you'll be able to get the right amount of sleep for your own, like, mental health, physical health and things like that, then it's not technically insomnia. But if it's something where we're now using it as an excuse to get back to, like, the things you said, okay, I'm going to have a whole big snack in the middle of the night, I'm going to binge on a show, I'm going to now, be more awake and alert, but oops, I need to still go to work by 9 a.m., then it's not necessarily biphasic sleep. I think we've now created a situation that we may get stuck in.
Yeah.
And I think, oh yes, like Dr. Mayer said, yes,
Yeah.
it's shift workers, of course.
Yeah.
That's definitely a situation. So I think if you're in a situation where that's a system by which you can get more sleep rather than a cop out from getting the amount of sleep you need, then in that case, it's something that may be a potential option for you.
Yeah. It's really about how it works in your life and if you're bothered by it, if it creates a problem. That's kind of how I think about it the most. So
yeah. So there's a question here about vivid dreams.
Yeah.
In menopause.
Pregnancy. I didn't say what the other one was. I said the vivid dreams during pregnancy. Yeah, I mean, that one is pretty common. I don't know. Did you experience vivid dreams during pregnancy?
Oh yeah,
I did too.
Yeah.
I think of a lot of the third trimester stuff is your body and your brain are preparing you for what's about to come. So I think of dreaming a lot of times as your brain is trying to process what's going on during the day and create a filing cabinet of how you're going to deal with stuff. And I think there's a large stressor that's happening soon. And I think that's a big reason why it's happening. And then I think I saw something about menopause. And
yeah, same.
I don't know about you, but I see it a lot during menopause, mostly with patients of mine who are taking a lot of medications, especially melatonin. So a lot of patients are coming to me on a lot of melatonin, and that can cause a lot of vivid dreaming and nightmares. So that's where I see it a lot of times. I don't know about you.
Sometimes I do. I see it when people are going through, like, changes, right? Like whatever it is, stressors or
Yep.
something, an anticipation. Think about a baby that's coming. That's a life altering experience about to hit you, right?
Yeah.
And menopause, there's so many changes physiologically and things like that. Yes. The melatonin piece, oh my goodness, that's a whole other show, right? That
Big
happens
question now.
because people are on supra physiologic doses of melatonin. Most of the time, even if you do need some melatonin, usually we're on much higher doses than we should be using, especially since our brains produce just this tiny bit that helps
Yep.
you sleep. So at times, backing off on the dose of melatonin, again, practicing healthy sleep habits, avoiding watching horror movies or super jarring, stimulating stuff
Yep.
before bedtime helps, you know.
Yeah.
Oh, this has been awesome. Okay. One last word. That's it. One last word. Okay. What would you say as we say goodbye in that sense?
I big fan of, like I say to everyone, people are getting sick of probably me saying it, is sleep hygiene is important, like we were just saying, but it is not the end all be all of sleep problem to treat sleep problems. So you need that as your basis, but if that is not enough, there are many treatments out there, like we were talking about, to help women of all ages with their sleep. There's all different types of treatment, and you need to find a doctor who's going to listen to you and think about you from a whole perspective, mind, body, life, who will really give it the attention it deserves.
Perfect. I love it. I'm gonna go back to your book. So y'all need to go Dr. Harris' book, The Women's Guide to Overcoming Insomnia. I think that's a great place to start because listen, there are just a few of us. There are a few of us that do this thing, that doing this work. And my clinic has a 6-month wait list. It's
Yeah.
just a joke right now, right? So that's a great book to start with if you know you're dealing with at least some
Yeah.
steps that you can put in place.
Yeah.
And then you could then see how things are, discuss with your physician, and then,
Sure.
try to find a place.
What I love about Instagram is that, and just the way the world's moving now, is that it's giving me more connection to other people.
I know.
I've been
You.
doing this for 20 plus years. And just
Yeah.
as a psychologist, there's a very small amount of us as clinical psychologists who are behavioral sleep medicine experts. And I've known the same people for a number of years who are wonderful, but it's really helping me to get a network of people to refer to who I know are well vetted and qualified. So it's a wonderful way, I think, for us to be getting out evidence-based information to people.
Absolutely. So follow us, Sleep
Yeah.
Doc Shelby, and follow me, Restful Sleep MD, and we'll kind of get this word out there. Thank you so much. I love what you do, and this has been so much
Being
fun.
here. Thank you, and have a great weekend. I'll talk to you later.
All right. All right. Take care. Bye, everyone.